patients with relapsed refractory ALL that have a relapse in an isolated extramedullary disease manner are usually excluded for all CAR-T-cell trials. And this may have different reasons. One of those reasons might be that this type of disease that relapse exclusively in an extramedullary setting, might be enriched with a different behavior, might harbor different biologics. So this leukemia might have a special capacity to evade T-cell immunity. So there are some concerns about if CAR T-cell therapy might also face lower response rate in this type of specific population. So these types of relapsed isolated extramedullary disease is quite, it's known, especially in patients relapsing after allogeneic stem cell transplant or after T-cell engagers like blinatumomab. So what we wanted to do is to analyze the outcomes of this specific type of population treated with our academic CAR-T-cell product, which is ARI-0001 cells and autologous second-generation CAR-T cells directed toward to CD19. We analyzed our first 60 patients with relapsed refractory ALL. Of them, 18 had this type of relapse, isolated extramedullary disease. We found these situations by PET-CT in 78% of patients with active disease by PET-CT and 28% by lumbar patch function with infiltration of the spinal liquid. So these patients had a median age of 27 years and were heavily pretreated with a median of 4.5 prior treatment lines. It wasn't a surprise that 33% of them had relapsed to blinatumomab and almost 90% to at least one allogeneic stem cell transplant, and also 50% to prior inotuzumab. So we were able to treat these patients with a vein-to-vein time of 42 days. And first of all, regarding safety in this specific population, we saw a 50% of CRS, but was almost always mild. We saw no case of severe CRS, with only a 5% use of tocilizumab. And also we have only of ICANS that didn't require any type of treatment, no steroids. So the safety profile of CAR T-cell therapy in ALL with isolated extramedullary disease in this population was very, very good. And regarding efficacy, we saw a 94% of overall response rate, with a complete response rate that included not only the bone marrow, but also the extramedullary disease of 78%. So with a duration of response at 2 years of 52% and a progression-free survival at 2 years of 49%. So just to conclude, what we saw with this small cohort of patients, of 18 patients, is that we had a great safety profile of ALL patients treated with CAR T-cell therapy with isolated extramedullary disease that was somehow expected as they didn't have disease directly in the blood or directly in the bone marrow. And regarding efficacy, we were surprised because the outcomes of complete remission were somehow not inferior to what we usually see with this same type of CAR T-cell in patients with affection of the bone marrow and the peripheral blood. So with this data, we see that this type of patients shouldn't be excluded for this kind of therapy. So this population was excluded from the conventional pivotal trials for industry-driven CAR T cells. These type of patients are excluded for commercial CAR T cells. with these outcomes, we do believe that they can also benefit for CAR-T cell therapy, and we should be treating them with this type of technology.